Hello, welcome to my channel. My name is Veronika. I'm an oncology nurse. I've been in oncology for 2 years now, but I've been a nurse for almost 10 years. I've worked in medical surgical, in cardiac, and also intensive care unit, and now oncology, which I'm truly enjoying. Today I'm going to be talking to you about chemotherapy patient education. And this is the exact information that I review with my patients prior to them starting chemotherapy. Just a little disclaimer that I want to put out there that all of this is really just for a guidance. You need to be working very closely with your oncologist and your nurses wherever it is that you're getting your treatments at. This is just out there to kind of help guide patients to have an idea of what to expect. And also note that I work in an ambulatory and outpatient center, so some of these interventions may be directed towards that type of facility. So if you're getting yours at a hospital, for example, some of these interventions may be slightly different. The first thing we're going to talk about is bone marrow suppression. This is caused directly by the chemotherapy. The chemotherapy is targeted to attack rapidly dividing cells, and that is exactly what your blood cells are. They are rapidly dividing cells, and they are made in your bone marrow. And when we start to see these numbers drop in response to the chemotherapy, this is called bone marrow suppression, also called myelosuppression. So in your bone marrow, it produces a stem cell, and then these stem cells mature into different lineages, and we have white blood cells. There are many of them, such as lymphocytes and neutrophils and many others. We have red blood cells, also called erythrocytes, and then we have platelets called thrombocytes. So we're going to go into detail a little bit more about how the chemotherapy affects these cells and what are the signs and symptoms. Now, your red blood cells or your RBCs, they carry oxygen to your body, to your organs and your tissues. And so when we start to see these numbers drop, we start to see very common signs and symptoms because of the lack of oxygen going to these specific organs. So a very common symptom would be like fatigue, but also shortness of breath, pale skin, or just an increased trouble or increased difficulty with activities of daily living. Now, there are treatments such as blood cell transfusions, and that typically is when your hemoglobin drops below 8. At least where I work, that's where the line is kind of drawn. And then depending on how the patient is feeling, the symptoms, and then that will determine, usually it's 1 to 2 units that are ordered for the patient. Now let's talk about white blood cells. Your white blood cells help fight off infection, whether it's coming from a viral, a fungi, a parasite, or bacterial invasion. But unfortunately, because chemotherapy starts to affect your white blood cells, then we start to see very commonly patients get infected because they just simply don't have enough of white blood cells to fight off the infection. So some of the common signs of infection that we know are coughing, redness on the skin, urinary tract infection symptoms such as burning, frequency, urgency, a fever, which is temperature above 100.4, a sore throat, sinus congestion, abdominal pain. Now, these are just a few examples. It's important to note that with cancer patients, when they're on chemotherapy and their white blood cells really plummet, unfortunately, we don't see any of these signs, and rather you might only see a fever, and that's because the white blood cells are the ones causing all this commotion. All these signs and symptoms are directly caused by the white blood cells when they're in action. So when you don't have enough white blood cells, you may only get a fever. So it's very important to be alert and notify your oncologist if you note any of these signs or symptoms, and especially if you have a fever. Now, your platelets are cells that clot your blood when you have a cut or when you have any injury. And when we see the platelets drop, it's very common to see easy bruising. We can see something called petechiae, which are just little tiny red spots that can be anywhere like the arms or the legs. We can see sudden changes of vision or sudden onset headaches or just any abnormal or spontaneous bleeding that comes from the eyes, the ears, the nose, or the mouth. Now, to give you an idea of what we talk about low platelets, so a normal range would be from anywhere about 150 is the low norm up to in the 400s. That's a normal range of platelets. Then we start to get a little bit concerned when we start to see those numbers drop below 100. Critically low would be under 20, and that's when we start warranting a platelet transfusion, because we have a much higher risk of just spontaneous bleeding. It can be in the brain, for example, and that's where we might see the sudden changes of vision or these sudden onset headaches. Or it could be very mild signs, such as when you brush your teeth and you see some bleeding in the gums or just a mild nosebleed. Those can be some early signs that your platelets have been dropping. We're going to go into the gastrointestinal symptoms now. The GI system really can get affected by chemotherapy because these cells also divide and replicate quickly. So we start to see a lot of signs and symptoms, such as those that you see on the slide here, and we'll go into more in detail. We have nausea, there's diarrhea and constipation, mouth sores. We'll talk about nutrition and what to do at home and manage these symptoms. Start off talking about the changes that can occur to your mouth and or your tongue. Most commonly than not, the patients experiment changes in texture and taste. So they'll say that everything that they're eating either tastes metallic or just doesn't taste the same, or if the texture is different for the food. That can really alter their appetite. So one thing that you can do for that really is keeping the mouth lubricated, using mouthwashes that don't have alcohol in it, such as Biotine, or a mouth lubricant called glycerin, and that's all over the counter. You can find it anywhere, Target, Walmart. Also, mouth sores are very common, or ulcers, or an infection called thrush. And that, depending on what's going on, we can send either a prescription over, or you can do baking soda rinses. That usually can kind of balance the pH level in your mouth. But again, just depends on what's going on. So just communicate to your nurse, and they'll probably look in your mouth and see what it is that's going on so we can help you more directly. Also, it's important to let your oncologist know if you ever need to do any dental work. The dentist should know that you're on chemotherapy, and they may request that you go get a clearance letter from your oncologist prior to doing any procedures, because depending on what your blood counts are, we don't want to be introducing any possible bacteria into your bloodstream. And we all know that our mouth has a lot of bacteria in it, and at the dentist they'll be cutting, and so that's a direct introduction from the bacteria in your mouth into your bloodstream. So we may want to just get a little bit of a clearance prior to doing your dental work. Now, nutrition is super important, and hopefully, you have a chance to speak to a nutritionist or a dietitian wherever it is that you're getting your treatment at, because that can be very helpful when you have a one on one nutritionist talking about your specific needs and your comorbidities or anything else that you're going through. So, to go over this briefly, we always recommend that patients do small, frequent meals. It's definitely much easier to digest, obviously. We want to do high protein and high calorie foods, because naturally, when you have cancer, you're burning off more calories. So we want to be able to bring those calories back in your body, give yourself more protein, and kind of give yourself a little bit more energy, so that way you can kind of get through your your chemotherapy cycles. Now, it's super important. I cannot emphasize enough how important it is to really hydrate with water. Coffee and tea normally is okay to drink, but again, if they have any caffeine in it, it doesn't count towards a cup of water. So, minimally, we say 8 cups a day. If you can get more in, better. And whatever you need to do to get it down, if you don't like the taste of water, you can add some lemon slices in there or little drops of the flavors that you can add to water. Whatever you need to do to kind of get that water down. It's very important that you hydrate yourself and help flush out any toxins that are being released. Electrolyte drinks are usually recommended as well to kind of replenish any electrolytes that might be lost during certain episodes of diarrhea, for example. And then protein supplements like Ensure or Boost, and there's many other brands out there, but these drinks have high amount of calories and protein and can be quite helpful for patients who just don't have an appetite to eat a full meal, and so they kind of supplement. They usually have around 300 calories and a lot of protein in the drinks, so they can really be drinking from like one a day up to like 3 or 4 a day, just depending on how much food you're actually intaking. Now let's talk about nausea and vomiting for a little bit. Prior to starting your chemotherapy, usually you will be receiving some form of a nausea medication in the IV if warranted, and also the doctor usually sends a prescription for nausea medication for you to keep at home and use as needed. And I recommend that you use it as much as you need to. So if it's every 4 or 6 hours and you're quite nauseous at home, that you use it every 4 to 6 hours to keep those nausea levels at bay. And it's also helpful to eat a bland diet. A brat diet is very common. It's bananas, rice, applesauce, and toast. So basically, you're just wanting to avoid anything that might irritate the stomach, such as caffeine, acidic foods, fried foods, fatty foods, and just kind of stay bland just until you kind of get over this nausea. And if you do start to vomit, it's important that you notify your physician. If you have more than 24 hours of vomiting, you need to be calling the nurse triage or going to the emergency room depending on the acuteness of the situation. Next, let's talk about constipation. You need to watch for changes in your normal bowel habits, which differ from person to person. You can have one person have a bowel movement 2 to 3 times a day, and another maybe just once a day or once every other day. So it's important to first know what your baseline is so that you know when there is any changes, and then follow very specific steps that your oncologist may provide to you. Usually, they'll start with some over the counter medications. Colace is a stool softener, Senecod is a stool softener with a laxative, Miralax is a laxative, and all of these are available without prescription. But your physician should be giving you some direction, as in how many of these to take, how long you should take them before moving on to something stronger. And just know that you need to be taking care of this promptly so that you don't run into any further complications such as a bowel obstruction because we didn't deal with it promptly enough. Diarrhea is a common symptom experienced by a lot of patients and directly caused by the chemotherapy. So there are very specific instructions that we provide to our patients on how to deal with this at home. I give them a instruction sheet with steps on it. First step is always to increase your fluids. Hopefully you can also put some electrolytes in them. Avoiding any types of foods that may irritate your intestines anymore, such as those listed here, dairy, caffeine, fat, and fried foods. Following a bland diet, as we've talked about before, the brat diet, and then a medication called Imodium. We recommend to our patients that they start with 2 tabs with the first episode of diarrhea, and then with each subsequent episode, they take 1 tab with a maximum of 8 tablets in 24 hours. And if that doesn't work, then they need to be calling their office. The oncologist needs to know if they're having more than 24 hours of diarrhea. They may direct you to the emergency room, or they may have you come in, for a nurse evaluation perhaps, and prescribe something a little bit stronger and maybe give you some IV fluids as well. Chemotherapy can cause a slew of other symptoms that I haven't reviewed in detail, so I'd like to review some of them here now. Peripheral neuropathy, for example, is a common side effect from certain chemotherapies. What that is a sensation of pins and needles on your feet or on your hands. And it's important to communicate that to your nurse or your oncologist before it gets too severe. Skin changes are also seen. Rashes can be seen, or the skin can get very dry and thin. Sensitivity to cold and cold drinks is very specific to a chemotherapy called oxaliplatin, and the nurse that you have should be reviewing this more in detail with you. Hair loss as well is another side effect from chemotherapy, but not all chemotherapies. That's a big myth out there that all chemotherapies cause hair loss, because they don't. There's a lot of new treatments out there that work effectively against cancer and don't cause hair loss. If you do have a therapy that is going to cause hair loss, just know that this is not a permanent side effect. It is temporary. Your hair will grow back. Typically, hair loss can be seen about 1 to 2 weeks after your first cycle, and then growth can start to appear about 6 to 8 weeks after your last cycle, with full hair growth between 1 to 2 years, depending on how fast your hair grows. Fatigue is the number one symptom experienced by all patients that have cancer and that are on chemotherapy. There is a research proven method to help with fatigue, and that is walking and light exercise. It is crucial for you overall to really help manage the fatigue, and you can make modifications as necessary, obviously, to your daily routine to conserve energy. Setting small goals for the day will really be helpful for you. Trying to not nap all day, staying well hydrated, and having a good bedtime regimen have all been proven to help manage fatigue levels. Mood changes are often seen with patients for the obvious reasons that you just got diagnosed with cancer, told that you need to start chemotherapy, and it is a life altering event. So it's very common to see patients experience anxiety, depression, anger, feel isolated because of this alteration in their daily life routine. So it's important to try and not isolate yourself. Continue to work if you can, continue your regular life routines, and just modify as needed when needed. And also know that there are support groups out there. There are local ones, and also online you can contact some societies, for example, the American Cancer Society. Let's talk about comorbidities for a minute. There are many patients who have hypertension, diabetes, and other comorbidities that they have to manage while they're getting chemotherapy. First thing to mention is that your oncologist does not become your primary care physician once you have cancer. You still have to see your specialist, your cardiologist, your pulmonologist, and your primary care physicians to manage those other diseases. But to mention a few things such as hypertension and diabetes, blood pressure medications may need to be modified or even held due to many reasons, such as dehydration and other medications that can drop or elevate your blood pressure. More often than not, we may see the patients needing to hold back on their blood pressure medications because their blood pressures are too low, directly caused because of the chemotherapy dehydrating them. So it's important to check your blood pressure before taking your medication, and also getting parameters from that prescribing physician, meaning they're going to tell you when you shouldn't be taking your blood pressure medication. The same goes for your diabetes medications. A lot of patients receive steroids around their treatments for different reasons, and unfortunately the steroids cause an increase in your blood sugar. So you have to manage and monitor your blood sugars maybe a little bit more often than you did, and you may need to modify your medications or increase the insulin. But your prescribing physician needs to know what's going on so that he can help you best manage your diabetes. And then overall, all other medications prescribed by primary care or a specialist, it needs to be monitored and refilled by that ordering physician for the most part. Pain medications are usually prescribed by a pain management physician. Sometimes the oncologist can prescribe pain medications, but once it reaches a certain point, they may ask you to see a pain management. And also important to take your pain medications with you wherever you go, so that you can administer them on time during infusions, for example. So some patients need to get what we call a port, which is a central venous access device. It's a surgically implanted device that goes just beneath your skin, below the collarbone, either on the left or the right chest, which the surgeon determines. And this allows the nurse to be able to access the veins at any given time. They can draw labs and then also infuse your chemotherapy or IV fluids, blood products, whatever it is that you need, without having to worry about finding a vein. So there's a few things that need to be monitored if you have a port. You need to be assessing the skin above and around to make sure that it looks good, it looks like it's healing, that it doesn't become red or swollen or painful or more bruised. If there is a lot of bleeding, you need to let the nurse know. If you get a fever, if any fluid leaks out of the port, or if you have any sudden shortness of breath or dizziness, those can be some signs of a complication that can happen with the port. And also